Hello, children. Very good morning. It might be a good afternoon. I don't know whichever time it is. I hope you all are doing very fine because we are studying about health and hygiene. Yes, and in these days rather, we are supposed to be very conscious about our health and especially hygiene. If we are hygienic, we will be healthy rather. Okay. So let us go ahead. We have covered till what is right from what is definition of health, disease, then various diseases, their symptoms, then the preventive measures, what is vaccination, what is immunization, what is the difference between them. Then we have seen how are we supposed to prevent these diseases by taking simple precautions. Finally, we have come down to the topic in case there is some kind of an injury, then what is to be done. This can be done obviously at your age as well. In case you find anybody of these kind of victims, you can try to give the first aid. So let us see the definition first. First aid is the immediate help given to the victim to prevent an injury from worsening. So these words are very important: immediate help and from worsening. You need to give that immediate help because the time is not supposed to be wasted. You are supposed to act faster and give that medication so that the injury doesn't harm that person more, right, before the right help arrives. So this is just a basic step of what the medication is to be or treatment is to be given. So advantage of first aid is that it prevents the worsening of the injury or the illness. Yeah, so some conditions we are going to study, very basic things. Obviously things if you have that understanding of how you are supposed to deal with a particular injury. Fine. In case of bleeding, if it is a minor cut, okay, there are two things we are going to study. If it is a minor cut and if it is a deep cut. In case of minor cut, wash the affected area with cool running water and clean with antiseptic liquid. Okay, so obviously that area needs to be cool so that any kind of a bacteria is there because of which the injury has occurred can be removed. Also, for no infection to be spread, apply the antiseptic liquid here. After that, the liquid is not going to stay, so put a cream there, antiseptic cream and a clean bandage. Fine. In case of deep cut, you need to place a cotton pad so that it absorbs all the blood on the cut and pressed to stop the bleeding. So next action, you cannot do much. If there is a deep cut, it has to be treated well by the doctor himself. So take the injured person immediately to the doctor. In case now if there are burns, now this is a little serious matter over here, okay, but there are various types of it. There are few things, in few types at least you can act faster and try to help the victim. So it varies from whether it has just damaged the skin or the under part of the skin as well, or it has reached the bones. So and it has to be protected from bacteria as well. The treatment is essential because in such cases of burns, the bacterial infection is very fast. So you need to give some kind of a first aid to such people. There are three types. There is first degree, okay, second degree, and third degree. So there are degrees. We are going to differentiate this or bifurcate this burns into. First degree, in the first degree burn, only the superficial and it has to be affect, okay, it affects only the epidermis of what, like it is epidermis obviously of the skin. The outermost part of the skin is epidermis, below epidermis is dermis, and so on and so forth, which you will study further. So it is very superficial, just outside, just on the skin, like, okay, it has not reached any other part apart from the skin. Second degree is going to be it is going to be more dangerous. It is going to affect the underlying tissues and blood vessels and cause blisters. So in case if it is a second degree burn, it is going to be damaging the underlying tissues of the skin where blood vessels, nerves are also present, okay, and then it causes blisters also. Blisters is something like this shown here, small blisters are there. So In case of second degree, this is what happens. In case of third degree, it extends deeper and can damage the skin, underlying fat, muscles, and even it reaches the bone actually. And that is why the healing becomes very difficult, because it has reached and it has damaged the bone. So remember, first degree just the skin, second degree skin and the underlying tissues causing blisters. Third degree it reaches the bone through the skin, through the muscles, tissues, whatever is there, fats and all, fatty tissue and all, whatever, it will reach up to the bone. So minor burn, that was all about the sets of degrees of burns. In case of minor burns, we can wash the affected area with cool water. And if blisters appear, but in case if there are blisters, sometimes it does happen immediately, you get blisters if it is not treated immediately with the cool water. Like sometimes I work in the kitchen, I get so many times. Even your mothers must be, just ask her, while frying something or something, there is a burn, then what does mama do? She is going to take out some ice cube immediately, or she at least puts her hand below the running water. That really cools it down and it subsides and the blisters never occur. But if somehow it gets delayed, yes, even after a few seconds, then blisters appear. But in such cases, then area to be dipped in the ice cold water and antiseptic cream to be applied, so that the germs will not grow there. Okay, bacteria will not flourish there. It is because there are chances of pus formation and all. So that is why antiseptic cream, and obviously ice cold water is going to work better, because it has now penetrated much deeper. So it has to be cooled down immediately. In case of blisters. Now what happens if if it is deeper, okay, in severe burns are affected and blisters appear, do not apply water. So but if it is deep and there are blisters, then do not apply water, because water is going to give a chance for the bacteria to grow. Affected area to be covered with a clean non-sticking cloth or bandage. You can cover the affected area with the cloth, but which is not sticky, right? No, so it won't stick to the skin, or a bandage. Bandage is going to be the best if you have it in your first aid box. Next is larger burns need immediate medical attention. Obviously we cannot help if it is too much of a huge burning injury there. Then we should not try anything else, but then take the victim to the doctor, or at least intimate at least at your age. You cannot take anybody, but you can intimate some person who will be responsibly handling the situation and taking the person to the doctor. These are the various degrees of skin, where this is the first degree burn. So you can see three different layers: epidermis, dermis, hypodermis. First degree, only the epidermis red color is shown. Second degree, even the dermis is affected, it is kind of more reddish in color. Third degree, you can see even the hypodermis is, everything is just damaged. Just to give you a glimpse of how the damage can be. So that is all about till we have started with first aid today, and we have covered first aid in the key. We have seen what is the definition of first aid first, then we have seen what to be done in the case of bleeding, what is to be done in the case of burns. These are the two only things, because then in burns there are various degrees. Now last part of the lesson, we are going to cover a few more first aids. I'll just tell you what all things are remaining now. There are only first aid in the case of an object in an eye, then first aid in the case of unconsciousness, first aid in the case of swallowing poison, and the last first aid in the case of snake bite. That is all about health and hygiene. And we have decided, children, it's a good news for you, that health and hygiene will be only for the cycle test, and it won't be covered in your that 40 marks external examination, because we have much of a portion like reproduction in animals and other important systems, human system, body systems. So we are not going to study health and hygiene further after the cycle test. Is the very good news for you. You should be happy for that. So you can concentrate and focus on the other important topics. So this is all about today. You can start solving the exercise of the textbook, section 1 obviously, section 2, at least 2-3 questions you can write it in the notebook by referring the notes PDF, and there is no diagram as such in this lesson. Okay, but then there is a table, entire table of the disease, symptoms, preventive measures and all that, pathogen name. Please learn that, write it on a chart paper, so every time you pass through it, read it and learn that, and whatever is given. Okay, definitions are there, easy lesson to know. Basically it is more of a practical thing than knowledge and practical thing going hand in hand. It's very 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 useful for you, in case. Yes, so all of you take care, all of you be healthy, all of you be hygienic, and along with that, one more edge, all of you please be happy too, and make others happy too. That is also important, I think, right? No, children? Yeah, so eager to meet you sometime online. Okay, till then, bye bye, take care.